What's going on? What's going on, Warriors? Welcome. And I mean, welcome to a special broadcast of World Kidney News. We got some breaking news. I'm telling you, this coronavirus is serious, especially in dialysis units. And that's what we're going to talk about today, how this virus is affecting many dialysis units and warriors that's not being talked about. Now, we have a special report from Don P. Edwards, contributing correspondence. But we have a special guest. I mean, a special guest. So share this broadcast. This is only one of many times you're going to see this guy on this broadcast. All right, share this broadcast. Let's get up to 50 people today. But all the way from United Arab Emirates, they're on lockdown as well. All the way from United Arab Emirates, no other than half of the Brown Brothers graphic team, Jeffrey Brown. What's going on, Jeff?
What's up, Steve?
How you doing?
I'm doing all right, thank you. Thank you for having me on. It's a pleasure.
Yeah, man. Yeah. We want to thank you, man, for everything that you're doing far as raising awareness for kidney donors and recipients, man, because you and your brother do some spectacular work. And I know by you being overseas, mainly Jared is kind of like the front face of the Brown Brothers, but you are an intricate part of this duo. How is your wife doing right now? Because that's how you really got started.
Very good question. Incidentally, well, she's doing fine. Thank you for asking. She just traveled last week from El Paso, Texas, back here to Abu Dhabi. And, it's a lot of times we can say just in the nick of time, but sometimes you can say by the grace of God, because she and my daughter, Julia, arrived here, and the very next day, they stopped all travel into Abu Dhabi, whether you have a residence visa, right, or whether you qualify as a passport holder for visa upon arrival. And so if they had arrived, a day later, they wouldn't have been allowed to travel, but she's doing well. She takes her 3 anti-rejection meds per day, and sees her.
She only takes 3 meds a day.
She takes 3 of them twice a day.
Wait a minute. Now, hold on. You have many warriors who put pictures up showing how many medicines they take, be up to 30 and stuff like that.
Well,
and your wife,
it depends on how far along on the post-transplant journey they are. When my wife was in her first 3 months, even 6 months, she was taking loads. It was naturally, and of course, a lot less than what she was taking, pre-transplant, but at a certain point, it just became the 3 anti-rejection meds, and that was it.
Wow, that's awesome. So let's bring up our next guest, who has some breaking news all the way from Brooklyn, New York. Don P. Edwards. What's going on, Don?
Hey, everybody. How you doing today?
All right. Is it Brooklyn, New York? Where you're at?
I'm in Queens.
Oh, I'm sorry. My bad. I don't want to get stomped up.
It's all right. It's all New York.
Right. Absolutely. So, Don, you serve on many task force boards and other committees pertaining to kidney disease awareness and what goes on in the kidney disease community. And you recently heard some startling information pertaining to the coronavirus and clinics in New York City.
Yeah, I serve on the COVID-19 task force for my ESRD network, and we had our first meeting this morning. And I was a little startled when I heard the count of the amount of patients just in our New York area. Now, we know that New York is a hot spot right now, and we're currently locked down. However, patients do have to go out for their dialysis appointments 3 times a week. And I learned this morning that we have currently 79 cases of dialysis patients with the coronavirus in the New York area. And that was pretty startling. One of the good things that I did hear, they did have 3 patients that did recover and are in the recovery process. However, there were some other things that I heard that I want to discuss this morning that were of concern to me.
Sure. Jeff, if I may ask, is there any way you can adjust that light behind you? It's casting off a bright on the screen. There you go. I appreciate that. Thanks. Absolutely. So Don, what are some of your concerns that warriors need to hear?
Well, one of the things that I heard as far as patient care is concerned is that due to the lack of PPE, which is protective, what is it?
Personal protective
equipment, right. Due to the lack of the personal protective equipment, a lot of the staff are refusing to work and they're walking out, which is causing staff shortages. Another thing that is also causing staff shortages is that I'm hearing that patients are refusing to wear their mask throughout the treatment process.
Wow, I never would have guessed. I never would have guessed that would be the case, that patients themselves would be refusing to wear.
You would think that they would be the ones that would be fighting for the mask. You would think.
Right, and being adamant upon that being a requirement.
Exactly, but what I'm hearing is quite the opposite. Some patients are refusing to wear the mask, and then it's upsetting the other patients around them because they're refusing to wear a mask. And
and that's very understandable.
Of course. And so what's happening is if a patient refuses to wear a mask, they have to put that patient back in a corner somewhere, far away from other patients. But what is the real problem here is because this virus is so unbelievably contagious, is that they have no way of isolating these patients that do have the coronavirus. They have to treat in the unit with everybody else. So what they're trying to do is they're trying to isolate the patients that are coming up positive and putting them on the last shift at the dialysis unit. That makes perfect sense.
Put them on the last shift.
That makes perfect sense. So this way all of the other patients can get treated, get out of there, and then they bring the positive patients in. However, staff members are and rightfully so, are afraid, and the other patients are afraid. So I thought that this was a perfect time for us to really come on and address this now. This is becoming a little bit more than what we thought, and it's affecting our population now.
Right.
And
Don,
we need to straighten some of this out.
Let me just say this. They could also, most dialysis units only have 2 shifts on TTS. And so they can set up a 3rd shift on TTS for patients who are affected with the coronavirus, or they can set up if they have 3, because it's really impossible if you got 3 shifts and both, if all 3 shifts say are 4, it says like 20 chair unit, you can't move. You see, I mean, depending on how many patients come up positive, you may have to set up a fourth shift.
Mm-hmm.
You see what I'm saying?
But see, the problem is these patients are in various units. They're not all, they're not all
Sure.
in one unit. So we're having
Right.
issues with transportation. Let's say you have 5 patients in Brooklyn and 10 in Queens, and you have to transport all of these patients to the one unit. So they're having logistical issues. And also the drivers of these ambulettes are they're afraid to transport the patients.
So here's my question, Don, if I may
Sure.
interject here. For those staff members who are going to be treating the patients that have come up positive,
Mm-hmm.
what sort of personal protective equipment, PPE, are they wearing that's any different than handling the patients that are not positive yet, but just merely going to dialysis for their normal treatments?
Jared, as far as what I'm hearing, there is none. They do not have N95 masks. They don't have them. They're using surgical masks, the plastic face shield, and the gowns.
What,
So
the plastic gowns?
and I'm not even sure if they even have the plastic ones now. I'm seeing some paper gowns on television. But I don't know if they even have the plastic gowns still. I guess it all depends on the facility and what they have in stock.
Now, Jeff, what is the situation in United Arab Emirates? What's going on over there pertaining to this coronavirus and kidney dialysis?
Well, as far as, everything's shut down. The malls were just shut down like yesterday. Movie theaters are shut down. Restaurants are only allowed to serve a minimal amount of customers at a time, And look, all restaurants, as I said, are only allowed to accommodate, like, I think it's up to 10 maximum, right?
Mm-hmm.
The bars, the lounges, everything's been shut down. They're even saying, hey, it's not a complete lockdown, but they're saying only leave your home if you absolutely have to, right? And what's different here in UAE than States is that the dialysis centers are only in the hospitals. So there are no dialysis centers that are run by private, commercialized, secular companies.
Wow.
I gotcha.
Wow.
They're still pretty much open and under strict regulation. It was kind of bizarre. This last year, my wife's dialysis center that she went to for about 4 years, it was transferred over and converted into a dental facility. And
wow.
A few weeks ago, she had to go there with my youngest daughter, who's now 14, so that Jayla could get braces put on her teeth. And my wife had to say it was the strangest experience going back to that dialysis center where she had to go 3 times a week, 4 to 5 hours for 4 years, and see it as a dental facility,
Wow.
Wow. That must something else.
That must be saying that they battling kidney disease over there to close down the unit or
no, they upgraded the facility for the dialysis center at the hospital.
Oh, okay. It wasn't closed down because
no.
lack of patience.
So Jeffrey, do they have cases out there? Do they have the?
Oh, they do. They have patients. The Middle East is they drink a lot of tea here, and they put a lot of sugar in their tea. So we have a lot of people that that acquire diabetes.
Yeah.
But y'all eat meat.
And that's
Do they eat
mainly
meat over there?
where they get there. I'm sorry, Steve?
Do they eat animal fats over there, like animal protein, meat?
I mean, they eat a lot of beef, lamb, chicken,
Oh, okay.
but they mainly get the kidney disease through diabetes.
Mm. So what
Right.
about the COVID virus? Are they having any outbreaks there?
I mean, we've had some, and yes, I think we've had one person die here from what I've seen, but that doesn't disclose what age that person was, the private personal information that PPI on that person, for good reasons. But they pretty much they shut down all flights coming in and out of UAE. So they closed the valve, so to speak, so they could isolate and treat anyone who had it already. And I'm pretty sure that most all countries are doing that, so that not more people can come in with it and transmit it.
Right. We have
something I think happened, in all countries a lot sooner, really.
Yeah.
Right. We have Isabel Martin from South Africa. She says her dialysis units are 24 hours. Hers is at a hospital, and she said that quite a few are at hospitals as well in South Africa.
Yeah. So I guess that freestanding unit is something that we have here.
Overseas, they have them over there too. They have Fresenius and DaVita. They just under other names.
I see. Yeah.
Yeah, absolutely. They ain't going to stop here in the United States.
I know Fresenius is global. So they're all over the world. Yeah.
Yeah.
But as far as this present situation here with this health crisis is concerned, I know that a lot of patients are concerned. That there is some difficulty in certain areas and certain neighborhoods. For example, in my neighborhood, we don't have a lot of meat in the supermarkets, and cleaning supplies, paper products, and things like that. So I know that is particularly stressful and maybe difficult for patients. And with that being said, a lot of people are shopping at convenience stores where they're not able to buy the fresh meats and the fresh foods that we should be eating. So that is a bit of a concern. But I just want to say to patients, we still have to adhere to our diets. And if this crisis continues and staffing shortages continue at the dialysis units, one of the things that I did hear was they're going to have to start considering 2 times a week dialysis treatments, which is of a big concern. So, so adhering to your diet, keeping to your fluid restrictions, and wearing your mask and washing your hands and keeping up on your hygiene is going to be of your utmost concern right now and of the utmost importance, because if they have to cut down due to staffing shortages to 2 times a week dialysis, we're definitely going to see some issues.
But this isn't just in New York.
This is what I'm hearing in the New York area.
Okay.
So if it is
right, but
this is where the biggest hot spot is in the country right now. So we're going to be the model for
what would be the second biggest hot spot in the States? What would be the second biggest hot spot in the States right now? Would that be Florida?
I believe it's either Chicago or California. Those are the 3 hot spots that they're talking about right now. Chicago, California, and New York.
I would hope that there are companies out there, grocery stores, companies that would step forward and do an online delivery service. So
Let me
they don't go
let
to
me
these
tell you,
convenience stores
Jeffrey.
and buy canned food.
Yeah, we've been trying to use the online delivery services because there are several, and
Hmm.
they don't have delivery spots open. Like I've tried to order food for myself, and I went all the way up until April 4th, and they had no delivery slots available.
But hey,
So they're
yeah.
They're backed
backlogged.
up. They're backed up.
Now check this out. I want to make a note here. Paul in the UK says at his unit they have section off some of the dialysis bays and built around them, especially for any COVID-19 cases. Now, isn't that a possibility too, Don? Where maybe the clinics here, maybe instead of using say for instance, for each shift, right? If any patients are positive on that shift, section them all off, to one area, and then the same goes to the next shift. Whoever's positive on that next shift goes in that same area. Could they possibly designate an area, and then instead of maybe the patients going twice a week because of staff shortages, maybe they can split to team nursing where you can have, instead of one tech or one nurse per 3 patients, you can have one tech per 5 patients, or one nurse
Well,
per 5 patients, where they do in other states.
yeah. I mean, all of that it sounds feasible. Again, we're talking about 79 cases, and there's 234 units in the New York area. So, I mean, we don't know specifically where these patients are because I mean, it may be one here, one there, and one there. So I'm sure they're doing their best to isolate them as best as possible, and maybe transferring patients, because I did hear that they're going to start looking into transferring the patients so that they can get a few of them in one unit. But if you have one over here and one over there, building walls and all of, building isolation and everything is not necessarily feasible.
Mm-hmm. Mm-hmm.
No, that's a logistical nightmare.
Exactly.
Mm.
Exactly.
Now, by you being an advocate, Don, how has this coronavirus impacted your advocacy work?
Well, to be honest, it's just about put my work to a halt. We're not allowed in any facilities right now. All advocates are banned from our facility work, so I'm not able to go out and visit and talk to patients. And I, I'm I'm in the house, so everything that I'm doing is by way of conference calls. I am participating in a lot of team conference calls um, uh, and webinars, so that I can learn more about what's going on in the facilities, so that I can lend my opinion to those who are trying to develop strategies on how to deal with this situation. So they are utilizing me to ask me for my input, and I really appreciate that. But other than that, I've been in my house since I got back from Florida, and I don't have any plans on going out to keep myself and my mother safe.
Mm-hmm. Now, let me
Yeah,
ask you
that's good.
one other question, Don. How how important do you think broadcasts like this is during a time like this?
This is up to date breaking news right now. This hasn't been discussed with on any other uh community or any other organization or anything. This is, this is important news. This is what patients need to hear. They need to know so that they can get an understanding. I really want patients to know the importance of wearing that mask during dialysis treatment, not only to protect yourself, but to protect the others that are caring for you. If the staff members are afraid to come to work, they're not going to come in, and you're not going to get the quality of care that you were originally receiving. If there are staff shortages, that means that they have to rush and they have to get people to come and fill in, and you're going to be getting a lower standard of care.
Right. And also
So,
put
Right,
people at risk.
standard of care.
yes, it's way too risky right now. And I know that this is a frightening time. This is a time for a lot of anxiety and a lot of concern. But the best things that we can do now is to follow instructions and really try to be as agreeable as possible. Get in there, get that treatment, and get out of there.
Wow. Now, Jeff, how has this coronavirus impacted the Brown Brothers graphic team? Meaning, I know you can still put out there, the information that you're searching for a donor, but aren't hospitals right now postponing transplant surgeries?
I've heard that, and I also read today. Read an article from Eunice that specifically says and addresses organ transplants as essential surgeries, not elective surgeries. And they should be treated as such. But I've heard a lot of hospitals postponing surgeries, and that is just outright a travesty, and it's sad. It shouldn't happen, But as far as mine and Jared's pages that we advocate for, we've not heard of anyone yet. A surgery postponed. We have a few people that are on the brink of at the doorstep of getting a transplant surgery scheduled. So we will very soon find out about that. But what we have seen, however, is a dip in the views on posters, and videos of ours, on pages, because people have a lot of other things to think about other than cruising and stopping on our posts, I guess.
Yeah.
Wow. Now, you mentioned something about someone's in the process, on the brink of getting surgery. Now, what about the people who maybe just started the process? Now, some states, Department of Human Services have ceased people from going in and saying they may need an EKG or a certain procedure done to get on the list. Those may be canceled until further notice.
That is, in my opinion, that is just wrong. That should not happen. What else should not happen is these transplant centers stopping people, that is living kidney donors, from going through the steps before surgery to be deemed and evaluated as a match or not.
Right.
Well, I just, this is one of the things that we talked about on the call today. I don't see the problem with going through the evaluation process and getting the patients listed and getting them ready. However, as a patient myself, I would be extremely concerned right now if I was to get called for a transplant, with this virus going around, because of the amount of immunosuppression that takes place right after that transplant. They completely turn your immune system off, and you don't know about the condition of the staff members, what nurse is going to come in to look after me. You may need a ventilator post transplant surgery. Some patients do need a vent after transplant surgery, and they're using all of the vents, so they have a shortage of vents for these COVID patients. You don't know if the nurses or the doctors or the people that are delivering your meals to you, you don't know who has it,
So,
right
so
now.
in essence,
So
Don, and you made some very valid points, and there
yeah.
are a lot of variables that come into play here,
Oh yeah.
and
Yeah. I mean,
you know
it's a hurtful thing to think that you're right here at the brink, and now here's this virus, and now I can't get my transplant. We want to get off of dialysis so bad, but I mean, who would want to take that chance and that beautiful gift of life and risk
and
losing it?
you know what?
You
It's
know?
probably. I mean, there are some people that probably would roll the dice on that, and
Yeah.
Oh,
just
I'm
like
sure they would.
we've
I'm
had this,
sure they would.
just
You know,
right, just
just
like Steve, you've had discussions before about whether people would take a Hep C kidney, uh, and
oh yeah.
it's a roll of the dice sometimes,
Yeah,
right.
it
but
really is. It
Oh,
really
let me
is.
just
if
clarify some
they
things right
turn it
quick.
down now, who's to say that they will have this opportunity later, down the road?
Right. Wait a minute, Jeff. I just wanted to clarify something. Candy, this is Jeff Brown, Jared's twin brother from United Arab Emirates. But she says this is true, Jared. At first, living donors were considered elective, but Secretary Azar spoke to that last week, and all transplants will be done as well as all workups. Okay. Thanks, Candy. But this is Jeff, his twin brother. And then Don, you had a
Yeah.
post. Paul says, I don't know the woman's name, but she is making a lot of valid points and totally correct.
Yeah,
And
Paul,
that's some props your way, Don. And he's
yeah,
right.
yeah, yeah.
and Paul, Don is 29-year kidney warrior. Don, can you just share your experience with kidney disease for people who
Oh,
may not know?
yes. I started dialysis when I was 23 years old. I lost my kidney function after 2 years after giving birth to my daughter. I started on in-center hemodialysis. I did that for 3.5 years, and I was completely disgusted with that. And I was introduced to peritoneal dialysis, which I did successfully for 10 years. And then I got a kidney transplant. I had the transplant, and that was an interesting experience to say the least. But that's for another show. And I had the transplant for 6 years. That rejected, and now I'm on home hemodialysis, which I did 5 years short daily dialysis, and now for the last 5 years, I've been doing nocturnal home hemodialysis. So that I think all of that adds up to a total of about 29 years. And I've been an advocate for over 20 years, um, advocating for patients and learning and teaching patients and professionals and giving the kidney disease perspective to anyone that wants to hear.
Oh, very well put together. Very well put together. Wow. And very good at what she does in spite of dealing with this disease for the last 29 years. Absolutely.
Yeah.
Don, may I pose a question?
Absolutely.
So, having done both peritoneal, well, actually, you've done all three.
Yes.
Which would be your preference, home hemodialysis or peritoneal dialysis?
I get that question all the time. I love to answer that question because now I'm gonna give you a smart answer. It really all depends on what it is that you want, what it is that you're looking for. Peritoneal
Okay.
is the easiest method. It's great if you're first starting on dialysis because it's needle free and it helps you to retain whatever kidney function that you have left. It helps you to keep whatever urination that you might be producing. It helps you to keep that
Okay.
longer. So if you're first starting out on dialysis, that would be my first pick. Peritoneal, needle free, easy to do, it's clean, it's safe, it's gentle. However, once you become more seasoned, and you have maybe more comorbidities, you may need better dialysis clearance. You may want a more effective dialysis. Um, the hemodialysis is like the Rolls Royce of dialysis. That's the best dialysis our country has to offer right now. It gives you the best clearance. It gives you you feel the best afterwards. People are able to really get their lives back and maintain their quality of life. So it really all depends on what it is that you need and what you're looking for.
Wow.
So do you do home hemo 4 times a week?
Yes, I do. I do my treatments at night while I sleep, and I do my treatments literally every other day.
And when she has to travel, some places she brings her machine as well. Just like she didn't let that stop her from going to Florida.
Yeah, I'm glad I got back when I did though. But yeah, I've taken my dialysis machine across country. I did a road trip with one of my best friends. We drove from Southern California all the way across to Southern Florida, and we stopped along the way and saw the different landmarks, and we stayed at hotels, and I treated at the hotels, and it was really great. It was a great trip.
Does it get calibrated once a year?
The machine, it undergoes maintenance. It's little things that you can do yourself, but they don't really need to be calibrated. You just do like little maintenance tests, and it's just really easy. Easy to do. It looks like a Fisher Price toy, to tell you the truth.
Wow.
The whole interface of it's really simple to do, and they have people that the customer support that you can talk to on the phone, and they talk you all the way through everything.
Don,
Yeah.
we have
Steve and I are old enough to know. Steve and I are old enough to know what Fisher Price,
Yeah.
what that means.
right.
Yeah.
Don, we have Paul. I think he's
Yeah.
from the UK. He's had 3 transplants. He's back on hemo now. Started 25 years ago and done home hemo, but still waiting to get back home this time around. Paul, what's holding you from getting back home this time around? I would like to know.
Yeah.
Wow.
I mean, considering what's going on now, I mean, this virus should be a wake-up call to all of us about the
Absolutely.
safety and efficiency of our dialysis. And I don't know if this was a self-fulfilling prophecy, but more patients really need to consider doing their treatments at home, not only because it's safer and more effective and it gives you a better quality of life, but look at the stress
Definitely.
that you have to go through, to get to treatment, to have staff take care of you, the staff, and you want the staff that you want to take care of you, and then there's the infection rates, and this is all really time for us to really start considering now becoming more independent and taking our care into our own hands.
Exactly. I think as well, it's not only a wake-up call for the standards that we hold for dialysis centers, but it's also a wake-up call for how we hold our hygiene standards for society.
Absolutely.
I mean,
absolutely.
it's going to rewire the way we think about touching anything and everything. Okay, like
That's true.
when you go to when you go shopping at the grocery store. Now, from here on forward, I'm going to make sure that's sanitized, or I'm wearing latex gloves, or when I go to an ATM machine, are those keys on that ATM machine? Are they clean? Have they been sanitized?
And it makes you think about things like that.
Exactly.
Who's been touching this? Who's been touching that? I've been wiping
You
down my
don't know.
groceries with antibacterial wipes when I bring them in.
Right. And even, okay, so let's say you use a credit card or your bank card, your debit card at the cashier, okay,
Yeah.
cash register, and you have to sign because it's over a certain dollar
Right.
amount.
Right.
And that cashier normally will just hand you a pen. You grab that pen ordinarily, and you
Yep.
sign the receipt, right? Well,
Right.
not now. Now you're going to bring your own pen
Right.
because you know your own pens are going to be sanitized and clean.
Yeah. And then you put your hands right in your face afterwards, you know. And we've been talking about these things for years. Steve's been talking about infection control since he's been on the air. I mean, there's the regular flu that kills thousands of people every year, you know, and there are patients that still refuse to get that flu shot, you know. And now that we're faced with this virus, which is three times more powerful than the regular flu, now everybody's all in a bunch. When we've been talking about hygiene and infection control and things of this nature for years.
Mhm.
Right, and so hopefully this raises the bar on how we look at any flu, because you never know moving forward
Because
now what other higher strains of flu are gonna come our way.
Exactly.
Yeah, yeah. When you say higher strains, hopefully people in the laboratories leave it alone. You know, because how many darn strains can you have, Jeff? And we've been on this planet for so long, and technology has come. I mean, really, the coronavirus has been around for a minute. This is just a
Yes.
different strain of it, and
A
I feel
different
like
strain of the virus.
somebody's been in that laboratory playing around.
So does the 19 connote it's the 19th? Is that the 19th strain? What does the 19 mean exactly? Does somebody know that?
I don't know. I was thinking it probably came out in 2019.
No, you're right,
It is the 19th
Jeff.
strain.
That strand, yes,
Oh, okay.
yes. So, Jeff, how long are y'all on lockdown? Did they tell you?
No, I mean, being that my wife and daughter came through the London airport on their way back from El Paso, Texas to come here. It was one of those listed, not only listed countries, you know, and if an employee or a relative traveled at one of these locations, being that happened, I'm actually self-quarantining for 2 weeks, and that's from 18 March until 1 April. So I'm working from home until 1 April.
Is your wife there with you?
Yes. So it's just a precautionary measure. It doesn't mean that my wife or daughter, you know, had the symptoms. You know, they were asymptomatic, but it's just a precautionary measure that they're having all people here in country, if they've traveled, once they come into country, they're to quarantine for 14 days.
Okay, so Candy, she's really into the scientific aspect of this. So she said it's the year, and there are thousands of corona strands. So yeah, thanks for clearing that up, because I definitely don't know.
You know, and I saw the gentleman posted a little while ago when you asked why isn't he back home.
He said that there's a shortage of tech staff to support patients going home. Now I think he's in the UK.
Yeah, but it's the same problem here. That's another big problem. There's a shortage of nursing staff and skilled home nephrology training nurses. So what's happening is patients are having to wait until there's an open spot to even get into training.
So somebody wanted to switch right now and they couldn't even do it. In New York, depending on where you're at.
Depending where you are, what would probably happen is you would probably have to leave your center and go to another one that has an available training nurse. Now, one thing about the Rogerson Institute, they have plenty of training nurses. They're just waiting for patients to come in so that they can get them trained. But some of the others, our Fresenius and Davitas, some of them have open spots, but the shortage is unbelievable.
Mm.
So
Wow.
we really need and that's an ode to our staff, because techs and nurses are worrying about patients going home, that they're not going to have jobs if all the patients go home. But that really is an ode to them to broaden their horizons and maybe branch out into home, and be a part of these home dialysis programs and help them grow and help the patients get home. That's something else to add to your resume.
Hmm.
you know
Let me ask you this, Jeff. You're a technical Army guy, but someone posed the question here, Angela. She says she was told even with organic food, once it's swiped at the register, it's no longer good no more because of radiation and the glass not being cleaned off. Have you ever heard about that? Like when you swipe, because that is radiation uh that's used when you swipe it with the bar scan.
Uh
hmm
huh.
I mean, I know we don't never think about this stuff, and even with 5G, have you heard anything in UAE about 5G going up?
Yes, but I've not heard about anything in regard to the radiation coming from that being a detriment or a hazard.
Well, right, but I mean, we never know. But I mean, you
I
know,
haven't heard anything about that, but
mm,
if you take a look, if people would take a look at the way that food is processed, and the machinery that's used to package and process, and there's way more radiation
Yeah, I will.
and chemicals and everything that are going into
Exactly. I would
actually
be
the
more.
food.
I would be more concerned with, yes, the sanitation,
right,
the environmental health standards upheld
Yeah.
in regard to the food, more so than this possible. And yeah, I would say very small
Yeah, I would
degree
just
of
make sure
radiation
I'd
that would
make
be coming
sure that
from.
I wash everything thoroughly and cook your food to the appropriate temperature, and just cook your foods thoroughly. Heat does have a tendency to kill germs, so maybe just don't eat it raw. Cook your
right.
foods thoroughly, and listen, we got to eat.
So,
And we don't just grow it out of the ground anymore.
Right.
Paul just interjected with a comment saying, "Isn't it merely an infrared? So just lights
Yeah,
Right.
come from that the scanning gun." And you know what?
yeah,
I don't know the details on that, but I would I think that's a smart enough guess.
yeah.
Mm.
I agree. I agree.
So
I don't
Don,
think that we.
Mhm.
Yeah.
right. No, I was just gonna say we kind of coming down, but to
Mhm.
the end. But moving forward, what do you suggest to warriors who undergo kidney dialysis inside a hemodialysis unit? What would you suggest they do to get past or push through this coronavirus crisis that's going on worldwide?
Yeah. My first thing is to listen to instructions. I know that things are different. They're difficult now, and you're feeling anxious about your safety and about your care. And just know that those who are taking care of you are feeling anxious, and they're feeling stressed too. So we're all in this one together. But the best thing that you can do is to is to observe all of the hygiene that you're taught. For God's sake, wash your access when you get to the unit. Wash your hands. Um, be vigilant. When you go to the dialysis center, watch what's going on around you. Um, you know, um, Stay away from crowds of people, because this disease, this virus, when you get it, it doesn't put a red dot on your forehead. You can't tell who has it. So avoid the crowds. We are immunocompromised. We do not have the same type of immune system as a healthy person. We are germ sponges. So no, I'm not saying to hide in the corner. We still have to live our lives, but we do have to be aware, and we have to be empowered, and we have to take care of ourselves. So I'm just saying to pay attention to what's going on around you, and to follow the instructions, and to stay away from the crowds. And if you don't have to go to the grocery store, see if you can get somebody to go to the store for you. And keep your hands clean, keep your hands out of your face. The same things that they're telling you to do at the dialysis center. Don't bring a guest with you, right now. Unfortunately, we can't have family members accompany us to dialysis treatments because of their safety and the safety of the other patients. So just listen out for further news coming from us on World Kidney News. Share this broadcast and stay tuned. And just everyone, just take a deep breath, turn on some music that you like, and enjoy being in the house, and live your life. Don't worry about Armageddon and all of that, because whatever's going to happen is going to happen. But you just want to be as safe as you possibly can, and be careful with your eating and drinking, and still try to maintain your health and your wellness as best you can.
Absolutely. Jeff, what about you? All the way from United Arab Emirate. What
But
suggestions
you know
would
what?
you leave?
Fortunately, we haven't had the mass hysteria, hoarders and shoppers at the grocery stores. I mean, when we go to the grocery store here, and I'm only doing it here. And we have a small grocery store here in our community, and I just go to it. It's not very far away. I can walk to it. But when you go to a grocery store here, you're still seeing stock shelves, and thank goodness that's the case.
Uh,
It's just crazy what I see on social media about what's going on in the U.S. But Don touched on something that I've been doing a lot more lately, and I would highly suggest this. Look, there are a lot of we're living in some very unprecedented, precarious times right now, and we need to keep a positive attitude. Yes, it's super important to abide by these new regulations and hygiene that teach us how to do that. But aside from that, we need to maintain a very positive attitude, and look at how you can do that, whether it's music, right? Whether it's concentrating on goals that you can accomplish things in the house, at
right.
home. It's about feeling self-worth and productive.
Yeah. I agree, Jeff. Prayer, meditation, talking to someone else on the phone. Turn the television off, for a while, and
I
wind
can't even
down.
watch TV right now.
Go and sit outside. Take a walk around the block, and come back. Just and just keep clean. That's all. But just
Absolutely.
don't panic.
Hmm. Now, when Don, are they going to know how to address this situation with the dialysis patients, with staff walking out and the equipment and stuff like that?
Well, it's things that are happening daily. That's why they developed this task force. so that we can check in with each other. So we're going to be having calls twice a week, just to check in and see how the progress is going. I heard on the news that there were pallets and pallets of PPE coming into New York, and they were supposed to be arriving today. Now, listen, we don't know if that's the case, and we don't know how quickly they're going to be distributed, because what's happening now, unfortunately, is dialysis is not really considered a priority. Um, PPE is going to hospitals first, and then trickling down into the dialysis units.
Well,
So
but
we don't know
normally,
when they're going to get this equipment.
those PPEs come in with the supplies on the dialysis trucks, like True Blue or
Right, but
whoever's delivering them.
what's happening is they're taking all of those. They're taking all of those and they're going to the hospitals first because there's such
So
a
what's left
shortage.
over will go.
Correct.
Basically, what's left over will go to the dialysis centers as
Correct.
they see fit and
Yeah.
distribute.
Yeah.
Wow.
Yeah.
Okay.
So
Wow.
there'll be daily developments. I'm going to keep you posted whenever I find out something new to share. Then I'll let you know so that we can let everybody else know. We definitely just want patients to be aware, informed, and to be empowered and
Hmm.
pay attention.
Sure. Sure. Absolutely. Well, guys, we're down to the little bit last of time. I definitely appreciate you guys coming on. Jeff Brown, half dual of the Brown Brothers production team. Uh, what's your next project?
I got a whole list of projects.
But
I mean, we're working for I listed a number of things, touch base with guys that are working, and after that, yes, I'm tackling goals at home, be it inside the house, in the garden, outside,
Oh, that's wonderful. That's
absolutely,
wonderful. It was such a
absolutely.
pleasure to meet you,
and
Jeff.
yeah, and coincidentally, Don, my wife and I went for a walk around the community here tonight, so it's important to get out, and do, some exercise and.
It really is. It really is. I highly suggest
Oh,
that.
absolutely, absolutely. All right, Jeff. Well, we thank you for coming on. Take care of yourself in UAB, and keep doing the amazing work that you and your brother are doing.
Oh,
Thank you for
Steve,
the prop.
I'm sorry. I just got one more thing. I forgot. I wanted to mention this at the top of the show. Medicare has approved telehealth. So, to patients that have doctor's appointments that don't, especially our transplant patients and our home patients that don't want to go out, Medicare has approved payment for telehealth. So, find out from your physician or your dialysis facility. DaVita has an app. I believe Fresenius has an app as well where you can download it and you can visit your doctor and have your clinic appointments via telehealth, so you don't have to go outside. And
So it'll
also,
be done.
yeah,
It'll be done by the telephone, telephonically.
you can do it through your tablet or your cell phone, like a kind of like a Zoom call, or what we're doing now. You can meet with your
Mhm.
doctor that way, and it's going to be paid for by Medicare, and it's HIPAA compliant.
Okay.
And another thing for our transplant patients who need to go in for blood work, if you're concerned about getting on the bus and the train going in for blood work, there's a company called Care DX. Care, CAREDX. That you can get in touch with them, and they will send a phlebotomist to your house to collect your blood for you and do your lab work at home. So it's like concierge lab service. It's called Care DX. You can look them up online, and you won't have to go out to do your lab work if you're a transplant patient. I'm sorry, Steve, but I
Good, you
wanted to
get
get
done.
that out. You know, I
Great,
always
great,
got a lot
absolutely.
I got a lot in my head.
All right, guys. So, Jeff, thanks for joining from UAB. We appreciate it. Don P. Edwards from
Thanks,
Queens, New
everybody.
York. Thanks a lot for that breaking news, and we'll see both of y'all guys later.
All right, now everybody
That's
have
right.
a blessed
Thank you,
day
Steve.
now.
All right, man. Take care, guys.
All right now.
All right, bye-bye. So, guys, this was a great show. It was breaking news. This is something that can happen in your unit, wherever you're at. So please take heed to the advice of Don P. Edwards and Jeff Brown. Again, thank you for this midday breaking news. We see you guys tomorrow for Warriors Quest at 8:30 with Jared A. Brown. Thank you guys for tuning in. We see you later. Peace. Let me get. Uh-oh. All right, guys. See you later. God bless.